Crowns are prescribed for teeth which are so badly damaged or decayed that they require a solid encasement to hold the tooth together, like this tooth with the large silver filling, which has developed an obvious crack. Before the crown procedure is started, an impression is first made of the tooth to be crowned. This provides a preoperative record that can be used to make a temporary crown and a permanent record of the unprepared tooth. Shaping the tooth for a crown is done with a tapered diamond tip using cooling spray to avoid overheating the living tissues inside. The preparation has a tapered shape to allow for insertion of the crown. The tooth is reduced enough to allow for an adequate thickness of whatever material the crown will be made from. In some cases, the core material of the tooth will also need to be replaced. Tooth-colored crowns must be thicker than metal crowns to withstand bite stress, so the tooth needs to be reduced more for those. With living teeth, the amount of tooth reduction is important because more tooth removal means a greater risk of inflamed pulp afterwards. When completed, the reshaped contours are recorded with either impression materials or a digital probe that scans the tooth and makes a computer model. In areas of the mouth where they're not visible, metal crowns may be an option. Most commonly, these include various mixtures of noble metals like gold, platinum, and palladium, but other metals can be used. Less expensive base metals can be used to reduce cost, but have a higher incidence of corrosion and allergy. Teeth which have sustained heavy damage to just a portion of their crowns can often be restored less invasively by covering only the damaged areas. A partial crown or onlay can be designed that spares healthy tooth structure and yet covers enough of the damaged tooth for the restoration to stay in place. The materials options for partial crowns and onlays are generally the same as for full crowns. The differences between crowns and onlays have mainly to do with margin placement and the use of internal retention features. Crown margins are generally at or near the gum line for the majority of their periphery. Crowns derive most of their resistance to dislodging from adherence to the external walls of the tooth. Onlays generally incorporate specially prepared inner walls to help hold them in place. They may cover as few as one of the cusps on a tooth, or they may cover the entire chewing surface. Sometimes, onlay margins extend only about a third of the way down the side of the tooth. Less invasive preparations that take advantage of advances in adhesive dentistry allow ceramic inlays, onlays, and crowns to be bonded to teeth with less tooth removal than was once possible. Ceramic restorations made by a computerized milling device are now available in some offices. These can prevent the need for a temporary crown and a second appointment. However, structural and aesthetic limitations of milled porcelain may mean they're not appropriate in all cases.